So the male reproductive system includes the scrotum, testes, spermatic ducts, sex glands, and penis. These organs together produce sperm, the male gamete, and other components of the semen. The scrotum here is a patch of skin containing the testicles. It is a dual-chambered sac of skin and smooth muscle located beneath the penis. The scrotal septum appears as a longitudinal line running front to back on the entire scrotum. So here you can see front to back. The scrotum contains external spermatic fascia, the testes, the epididymis, and ductus deferens. During puberty, the scrotum can be covered with pubic hair. So the spermatic cord is formed by the vas deferens and tissues from the deep inguinal ring to each testicle. The tunica vaginalis is a serosal covering of the testes which is derived from the peritoneum. Here you can see the tunica vaginalis as this white outer ring surrounding the testes. The testicles are the male gonads. The primary function is to produce sperm and testosterone. There are two testes that sit within the scrotum. One testis is typically lower than the other, so that any compression in the event of compact is avoided. The epididymis is a duct of tightly coiled tube behind the testes that connects to the vas deferens. This is where sperm passes through. It can be divided into the head, body, and tail. The pampiniform plexus is a network of many small veins found within the spermatic cord. The ductus deferens is what transports the sperm from the epididymis to the ejaculatory ducts. The ductus deferens are partially coiled tubes ascending into the abdomen through the inguinal canal. The testicular artery, which is represented in red, is a branch of the abdominal aorta supplying blood to the testes. The cremaster muscle, which is on the right, is a muscle of the of the spermatic cord, allowing the testes to be partially raised in some incidents. Here you have the superficial fascia ring layer, then the deep ring, and the inguinal canal. This is a cross-section of the penis. There's the two corpus cavernosum, which is innervated by the deep artery, and then the corpus spongiosum, which contains the urethra. Up here you can see the dorsal vein. At a posterior view, you can see the ampulla, which is the duct, which is in a large portion of the duct deferens. The seminal vesicle gland is located posterior inferior to the urinary bladder, which secretes fluid composing of semen. The ejaculatory duct is about 2 centimeters in length. It is created when the seminal vesicles merge with the vas deferens. On the sides, you can see the ureter, which is connected to the urinary bladder. Here you can see the rectum. In this view, you can see the bulbourethral, also known as the Cowper's gland, which is located right here, the ejaculatory duct, the prostate, urinary bladder, pubic symphysis, corpus cavernosum, corpus spongiosum, urethra, and the rectum. In this view, you can see the urethra coming from the urinary bladder to the penis. There is the membranous urethra, which is located right here, the prostate urethra, which is located right here, and the spongy urethra, which is located from here down to here. At the end, you can find the external orifice of the urethra. This view here, you can see the bulb of the corpus spongiosum, the crus of the corpus cavernosum, and then you have the glands, also known as the prepuce.